Eat your vegetables. It's something we all heard as a child. It's as if today's parents are telling their children to put the vegetables away. Good evening. My name is Destiny Stone-Patterson, a sophomore at North Carolina Central University, majoring in early childhood education. My general purpose is to inform. My specific purpose is to inform on the increase of childhood obesity within the United States. Childhood obesity has tripled since the 1970s. Tripled. When you go to the doctor for a regular checkup, of course you get your physical, you get weighed. Also, what they do not tell you is they weigh your BMI, which is your body mass index. This is the measurement of your weight and your height. At my doctor, preferably, we have a scale, and it says your height, your age, and your weight. Your weight on the scale provided, states what weight you should be at a specific age and at a specific height. If this is abnormal to your doctor, he or she will have a talk with you, explaining on either you are at risk for obesity or you are unfortunately obese. However, in today's society, the most problem we have is childhood obesity, which is why I'm here today. Children have a way of not expressing their self physically due to low self-esteem at an early age. As parents, as educators, as advocates, we have to encourage our children to get at least 60 minutes of physical education, activity a day. Physical activity is important when no matter if you're adolescent, adult, young adult. We stress this mainly within our children because obesity can become a long-term issue. With this becoming a long-term issue, they are at risk for chronic illnesses such as type 2 diabetes, high blood pressure, respiratory problems such as asthma, congestive heart failure, and things of that sort, which is something we never want to put our children in the harm or in the way of. So I ask you, as advocates, educators, and parents, even as citizens of the United States, please inform and spread the knowledge that you have on obesity, as it may save our youth. Our youth is our future, and without them, we have nothing. As a future educator, I plan to implement any type of physical activity within my classroom, whether it's jogging in place, working up our brains, doing jumping jacks, for the simple fact that I care about my students. I care about the youth. Like as I stated before, they are our future. So, with that being said, I would like for you to empower young students, and not even students, children of all ages, shapes, size, color, race, to be active. Being active, drinking water, focusing on your portions, because not so much of what you eat is how much you eat of it. And as adults and parents and advocates, we have to limit the sugary beverages such as Hawaiian Punch, High C, Capri Sun, things of that sort. Encourage your children or your students to drink water. Water is always the solution. And I also ask that you also be patient with children who suffer from obesity. Please explain to them that no matter what, it's patience. Patience comes with everything in life, and while that may be a tough time in their life, you have to demonstrate patience because nothing comes overnight. So, with that being said, I would like to thank each and every one of you for coming tonight. Is there any questions? No questions presented? Okay. Well, as a nation, as a community, as a future educator, please get involved in your children's life, no matter if they're your neighbor, your child, your student, or just a mentor, mentee, however that works for you. And please get them involved and get them physically active. I do not like the fact that our children, our future president, doctor, lawyer, is at risk for such chronic illnesses. Thank you. And once again, I am Destiny Stone-Patterson, a sophomore at North Carolina Central, majoring in early childhood education, where I will practice physical activity. Thank you.